I was diagnosed with sleep apnea 5 years ago in a traditional sleep center. The typical prescription at that point is for one to receive a machine, an CPAP machine, and a mask. And I did that successfully for several years. Several things caused me to change. One is it's inconvenient when you travel to take that with you, although it's certainly commonplace today for that to take place. I wanted something that was a bit more convenient. Also, it's annoying to be wearing a mask night after night, and for that reason, I decided to seek an alternative, and the Sleep Center recommended Bell Dental Group, and particularly Dr. Maggie Ernst, as someone who I could see. I was delighted because I was already a patient here at the Bell Dental Group, and so it was very easy for me to transition from a mask to a dental appliance. And after a short conversation with her and her staff about the process, I then agreed to proceed with the creating of a oral device. And I want to emphasize that because there are a lot of devices that are available to people, but I believe one that's customized for your particular jawline and teeth anatomy is important to ensure that you get the proper fit. I think that was the most important conversation that I had with her at the time, was what is the likelihood that I'm going to get something that's going to be as close as possible to my natural jawline, so that when I do sleep, I will be both comfortable, but that the device will also be effective and fully effective at that. In my estimate, it's just as effective for me as it has had the mask been. And so the transition was quite smooth. The improvement that I experienced with the mask has carried over quite nicely to the device. And so the benefits of having something that is smaller, requires less maintenance, and to be equally effective in my particular condition has made it a winning option for me.